So usually around like even the first month, a lot of patients will start to say like, I'm noticing more energy, my skin's clearing up,
Yeah.
my hair's not breaking as much, my nails are getting stronger. So we start seeing things like that fairly quickly. And then usually by month 2 or 3, we're starting to see it reflect on their cycles when they're charting. Periods aren't quite as heavy, PMS is decreasing, cramps aren't as bad, periods are
hmm
starting to get more regular. And then, really, by month
Yeah.
3 or 4, we're starting to see that positive pregnancy test.
Welcome to the Truth and Fertility podcast. My name is Haley and I am your host. I work at an OBGYN clinic where I teach women and couples how to chart their cycles so they can either achieve or avoid pregnancy and also to manage their fertility. I have a huge passion to teach women and couples about the beauty of their fertility and how the pill is never the answer to women's health. There's a lot of good and not so good information out there about fertility. And so my goal with this podcast is to help you sort out the truth from the weeds. I want to teach you how to chart your cycle and to reach your family planning goals while also maybe even possibly locating hormonal imbalances and to receive proper treatment. I want to help you get in the best hands that you can with the best doctors that you can to reach optimal reproductive health. So if you're ready to get on this journey with me to learn more about your reproductive system, how it was created and how it should be working, and the best medicine in order to make it work if it's not, then you are in the right place.
Welcome to the Truth and Fertility podcast. Today I'm on a very special guest. We have Dr. B on today. Her name's Dr. Barraza, but she goes by Dr. B. And so she is a naturopathic doctor and working primarily with fertility. And so I wanted to have her on today to just pick her brain about what her job looks like, what naturopathy looks like. I just told her before we started recording that I literally am starting at square zero. Like I know nothing about naturopathy. So I'm really excited to pick her brain and to get to know more about it. So Dr. B, welcome to the podcast. If you could just kind of give an introduction to you and to New Eve Health, which is your business. So I'd love to just hear about you.
Absolutely. Well, I'm so excited to be here. So, I'm Dr. B. I'm a naturopathic doctor and I focus on fertility. I started New Eve really as a way to do what I love, which is fertility and women's health. But I really started New Eve just to be a way that honors my patients and the Lord. New Eve is consecrated to Our Lady, Mother Mary, who is our New Eve. I really just wanted to start a practice that I could reach Catholics, Christians. You don't necessarily have to be religious, but a lot of my patients tend to be. But really just to have a space where you can come and feel heard and safe sharing your story of infertility, because it is such a vulnerable topic, and that should be the provided safe space for you is with a trusted physician. And also just a space where you never have to worry about being dismissed or said like, oh, just keep waiting, or let's try birth control, or oh, did you go to IVF? Everything that we do is going to be morally permissible with the church so that my patients are never compromised.
That's awesome. That is so beautiful. And we need so much more of you too. It is really hard to find a doctor nowadays that even just on a moral standpoint, you can trust. Like you're not having to really be on guard of what are they going to say, what are they going to suggest, and making sure that everything is really ethical in the way that they're practicing medicine. So that sounds amazing. Can you just go into being a naturopathic doctor? So what does that exactly mean? How does that differ from being a traditional doctor?
So naturopathic doctors, there are people called like naturopaths, and unfortunately, you have to be super careful with that label because a lot of people will label themselves as a naturopath. But if you look at their credentials, they're really just like a person that loves holistic medicine and like the holistic
Mm,
lifestyle. So
okay.
if you're working with a naturopathic doctor, you really want to find somebody who is one licensed, has passed their board exams. We do have a full medical program. It's very comparable to like a allopathic doctor, like an MD program. The only
Okay.
difference is really that they take one, I think, let's see, it's either a quarter or semester more of pharmacology,
Okay.
mostly just because they do a scheduled class of drugs that you would do like after internal surgery. And we do minor surgery, we don't do internal surgery. So since we
Okay.
don't do that, we don't need those meds. So we don't take that, but we do get extra training in like nutrition, homeopathy, herbal and botanical medicine,
Okay.
exercise, lifestyle, lots of other modalities. So very comparable curriculum-wise, which is awesome. We do have to go through two sets of boards to get certified and to get our license. So the whole curriculum is very comparable, which is great. We just tend to take the little like motto of naturopathic medicine is the root cause approach.
Yes. Yeah. And so is that really where, like, okay, getting into more of like the natural way to heal things, right? Like when I think of getting to the root cause of something, I think of, okay, we're not slapping a band-aid on it like the pill might do, right? Like we're actually getting to the root cause of what is ailing the person. So that is really great. So what are because you focus mostly on fertility, from what I know, what are the types of cases that you normally see and work with?
Yeah, I see a lot of primary infertility, so couples that have never seen a positive pregnancy test. I also see a lot of secondary infertility, so maybe they were able to have one, two, even three kids, and now suddenly they can't get pregnant. And then third, I see a ton of recurrent pregnancy loss. So maybe they can get
Okay.
pregnant, but they're often miscarrying, usually before like 10 weeks or around that time frame. So that's probably what I see the most. I see a lot of general women's health too, but I've really kind of stepped out of that and more into the world of fertility recently.
Okay. And then what is the typical like preliminary things that you do? So if a woman comes in or a couple comes in and they're saying, let's just go with primary infertility, they have really, really had trouble getting pregnant. What are the first things that you're going to do?
Yeah, so I always tell my patients, first and foremost, I am not in the business of band-aids. So we
Yes.
never start with like a medication. I honestly rarely even start with supplements. There's a term
Okay.
called like green naturopathic approaches, which is essentially just like using supplements like medications. They're just kind of like giving out like candy, and not that they can't help,
Mm.
but we have to be really careful because they can still distract us from not getting to the root cause. So
Yeah.
usually we start with super comprehensive testing, a lot of testing that patients are like, everything's coming back normal. And I always tell them, I'm guaranteeing you probably never had some of these tests done before. But
Yeah.
even if you had, we read them so differently as naturopathic physicians. If you've ever looked at a reference range for any lab, normal can be like 5 to 400, which is so far off from what we
That
consider
is.
optimal.
Yeah.
So
Yeah.
we
Right.
always start with crazy thorough testing and then really scrutinizing the results for optimal, not just normal.
Okay. So you said like we do a lot of testing, or you do a lot of testing that you would say like, I promise you've never had this tested before. So it's like give me an example of that. What is something that you would test that maybe traditional doctors wouldn't?
Yeah, I think two of the things that tend to shock my patients the most would be like one, a really, really, really thorough gut microbiome test. And a lot of times,
Mm,
even patients will be like, oh, I've had a stool test done before. And I'm like, no, I promise you, this one's different. So
yeah.
that's
Yeah.
probably one really big one. Another one is I test a lot for chronic infections. I have a lot of patients
Okay.
come in with like endometriosis, PCOS, thyroid
Mm,
disease, and those are not root causes of infertility. We have to figure out why the body is struggling with those diseases. And a lot of the times it's like environmental toxins or chronic infections. So a lot of those we can test for. So I always say if we can, why not? We want to know exactly what's going on.
okay. Yeah, and that makes so much sense because especially like in my world of charting the cycle, family planning and everything, right? Like you can really get to the bottom of, okay, does a woman have PCOS or does she have endometriosis? Even just by charting her cycle, by doing some tests from there. But you are totally right though that even that, I mean, that in and of itself might not even be the root cause. Like, okay, well, then what is causing that? So
100%.
it's even getting closer to, okay, let's get to the actual bottom of this. So, okay, let me throw out an example for you then. So let's say you have a woman who's struggling with infertility. She comes in, you guys do some tests, and let's say that you end up diagnosing her with PCOS, polycystic ovarian syndrome. Where do you go from there as a naturopathic or a naturopathic doctor that might be different than the traditional way?
Yeah, I think a big thing is we always determine the type of PCOS first and foremost, because there's a few different types. Not everybody's going to have the same type of PCOS.
Right.
And oftentimes, a lot of patients are just told, like, oh, start metformin. And I see a lot of patients that don't have insulin resistant, the type of
Mm.
PCOS. So it's like that's not going to help them. So
Yeah, that makes
oftentimes,
sense.
yeah, so we always determine the type, and that usually encompasses some of their other labs. Will usually kind of put that piece of the puzzle together for us. And then there's a lot we do with herbs are huge for PCOS, nutrition and lifestyle, especially like
Hmm.
removing environmental toxins. Those have been some of the biggest things I've seen, honestly, for most conditions, but especially PCOS.
Okay. So what does that look like with removing environmental toxins? What exactly does that mean?
Yeah, so I like to tell patients toxins are essentially things that like we think are totally normal, like laundry detergent, soap, our beauty care
Right.
products, gosh, just about anything you can think of, your Tupperware, your pots and pans. But a lot of the times they have plastics in them, especially like little microplastics. Like you can't see them. It's not like you're eating a big old chunk of plastic, so you're not really thinking about it. But our skin, being our largest organ, is so absorbable. So it's going to be taking in all those little microplastics, and they
Hmm.
actually mimic our estrogen. So that can drive our estrogen levels up. Sometimes it shows on labs, sometimes since it's synthetic, it doesn't. But a lot of times, all patients present with things like estrogen dominance, and it's usually just because they're constantly getting bombarded with all of these different toxins. So going back to
Okay.
the foundation, having them make some of those healthy swaps, gosh, it takes them so, so, so far.
Yeah. So you're saying that, so with the environmental toxins, you're saying that our body treats it like an estrogen or like it absorbs it like an estrogen, and that can cause our estrogen to be too high, which is what estrogen dominance is. Is that all correct? Am I following you?
Yes, yeah. And we
Okay.
can get it. There's other ways, lots of ways you can get estrogen dominance for sure. But a big culprit for sure is definitely going to be like plastic is such a big one. Plastic is
Yeah.
called like it has xenoestrogens, which are
Yes.
like the toxic,
I've
really
heard of that.
strong
Yeah.
estrogens. Yeah. So the way our body perceives it isn't like, oh, plastic, let's filter it out. It attaches to our estrogen receptors, but it's so much stronger than like our natural estrogen. So it really just makes
Yeah.
everything go haywire.
Okay, gotcha. And so treatment wise then, let's continue on with this example, right, of this woman struggling with infertility, has PCOS. So she starts to remove those environmental toxins. Maybe she starts taking herbs like you suggested. I guess this is two-part question. So when should she start seeing changes? And I guess what type of changes would she be looking for that kind of clue her into that her body is becoming healthier
Totally. That's a great question. I
besides
usually,
getting pregnant?
yeah,
Yeah.
which is definitely a big one. I do always tell my patients the process and the goal is to get pregnant in 4 months or less when we start working together,
Okay.
dependent
Okay.
on how committed they are to the process,
Sure.
how fast they're able to make some of those big changes. But really good results so far. So usually around like even the first month, a lot of patients will start to say like I'm noticing more energy, my skin's clearing up,
Yeah.
my hair's not breaking as much, my nails are getting stronger. So we start seeing things like that fairly quickly. And then usually by month 2 or 3, we're starting to see it reflect on their cycles when they're charting. Periods aren't quite as heavy, PMS is decreasing, cramps aren't as bad, periods are
Hmm.
starting to get more regular. And then really by month
Yeah.
3 or 4, we're starting to see that positive pregnancy test. So it doesn't take
Wow.
quite as long as people think, which is great. It can for sure,
Yeah.
dependent on how long you've been dealing with it. But if you're committed to the process, it can be fairly quick.
Wow. That is truly amazing too, because 4 months, I know when you are in the thick of infertility, 4 months seems like a really long time. Like when we were trying for our first son, it took us about 7 months, and I have PCOS, which is why I use that example, but it took us 7 months to conceive. And like when you're in the middle of it, oh my gosh, it just feels like forever. But in the grand scheme of things, 4 months is actually
Yeah.
very quick. That is a very quick turnaround. So that is really amazing. And you mentioned too, like, okay, it depends on how committed they are as well. So is that just like committed to change, like taking out all of, throwing away the plastic Tupperware, right? Like throwing, and is what, tell me what else, what other things that you recommend besides like environmental or removing the environmental toxins, things like herbs, you said. What are some other things that if a couple was really trying to achieve pregnancy, they were working with you and they wanted to just like go all in and hopefully, let's say in that 4 month time frame, hopefully get that first pregnancy test? What are some other things that other changes that they would be looking at making?
Yeah, for sure. I think first working with both husband and wife is so crucial to see results,
Yes.
especially fast results. A lot of the time I'll have the wife come to me first and she's like, "Oh, my husband he's young, he's healthy, he works out, he eats
Hmm.
well. Like I know it's me." And oftentimes they're shocked to find out that it's not, or it's a
Yeah.
combo. So really working with both, starting there is huge. And then
Okay.
setting the foundation, fixing like all the cracks in the foundation so there's a good solid foundation to build off. So we look at sleep, we look at nutrition, we look at exercise, and the type of exercise is huge, especially for
Okay.
women. So those are some big ones for sure. We look at even environmental things like heat is a big one. I have a lot of men that they go to the gym and then they, do a sauna to finish off their workout, and that is really not great for conception. So things like that, I try to
Wow.
have men stay away from. So really just kind of
Okay.
like getting to the nitty-gritty of scrutinizing the foundation, the lifestyle, nutrition, exercise, sleep,
Yeah.
stress for sure. Everybody is usually pretty stressed at this point. So
Yep.
finding like techniques that actually work for stress is a big
Right.
one. Yeah,
Yeah.
these are some of the
Yeah.
big things.
Yeah. Well, and I feel like too, you hear so many stories of couples that are struggling with infertility and then they go through the adoption process. And then once they're able to adopt that baby, then all of a sudden they get pregnant.
Yep.
And a lot of time I feel like it's because of that stress of just the whole process of going through infertility. And then whenever your stress is relieved, it's like your body feels safe to ovulate again almost.
Absolutely. Yeah, that is
Yeah.
such a big piece of it is making sure the body feels safe 100% of the time, or at least as
Yes.
much as you can. Because even if we think like, oh, we're totally happy and healthy and safe, the way our body perceives stress and safety is totally different than how our mind does. So yeah, you're totally right on
Totally.
that.
Yeah. And I want to ask you too about men and the saunas. So is
Yeah.
heat something that like it does it cause like inhibit sperm mobility? Like what about that is really dangerous?
Yeah, so the biggest thing is that it decreases sperm count pretty significantly. It can hit
Okay.
the other markers like motility, morphology for sure, because if you're constantly in a heated environment, when the sperm's trying to regenerate, it's going to start affecting those other markers, the way the body is able to synthesize healthy sperm. But
Yeah.
sperm count is going to be the biggest thing it impacts.
Yeah. You know what? And it's also making me think too. I mean, men's testicles are on the outside of their body because it's so sensitive to heat. Like if they were on the inside of their body, the inside of their body is there's too much heat there, which is
Yeah,
exactly why the Lord made men the way that he made men, where the testicles and the scrotum is outside of the body so that the sperm can live and be fully mobile. So that yeah, that I just like made that connection. That totally makes sense. Okay. So with all of this being said and like walking through that example, I guess I should have asked this at the very beginning, but like why did you choose to go in the direction of naturopathic medicine? Like what do you think the benefits are of going through naturopathic medicine versus traditional medicine? And for you personally, what made you go that direction?
yeah, honestly, my own health history, when I was a kid, so I was raised in North Carolina, so over on the East
Okay.
Coast.
Yeah.
And my family went camping all the time. North Carolina was such a heavily wooded area. We were constantly
Yeah.
outside. It was great. But I was constantly getting bit by ticks, which was not something that was abnormal for a kid in North Carolina. But there was one time I got bit by a tick, and we just remember it being quite larger than some of the other ones we had found. And
Hmm.
shortly after, I started getting symptoms. By this time, I was like probably 10 or 11, super active. I was ice skating, dancing, just my sister and I were just go, go, go all the time. And we
Yeah.
just had a blast. It was great. But then I started getting like crazy symptoms, losing weight. I couldn't eat.
Huh.
My joints were getting swollen, skin rashes. It took 10 years of just kind of being passed through the conventional medical
Wow.
system, being told like, oh, it's growing pains, oh, it's puberty, or oh, she has anxiety, oh, she's depressed. And then it was actually a naturopathic doctor that actually did diagnose me with chronic Lyme disease. And when I started
Wow.
treatment, it changed my life 100%. And now I've been lucky enough to be in remission for going on 6 years. And I really can only thank naturopathic medicine for that. So that is
Wow.
personally why I'm so passionate. We tried so many things for it. We tried medications growing up and all the other things that any conventional doctor said. I was transferred to specialist, and
Hmm.
we did all the conventional routes, and just I constantly felt dismissed. So that was, yeah, that was something that I think really hit my heart, and just feeling heard by a physician can take things so far in and of itself, but getting the right treatment and getting to the root causes was actually life-changing for me. And I just want that
Absolutely.
so badly for other people too.
Yeah, yeah. So you were not actually properly diagnosed until you went to a naturopathic doctor. Is that right?
That is right.
Wow. So tell me I've heard of Lyme disease, but tell me more about what exactly that is.
Yeah, so it's essentially just like a bacteria, but it's a really crazy kind of bacteria because it's shaped like a corkscrew. So it can kind of
Hmm.
screw its way into just about any tissue in the body. So after about 3 months, it often doesn't show up on blood work because it's hiding in muscle or fascia or other parts of the body. So I think that's in part why it took me so long. By the time we got all the tests, everything blood work wise was negative. And it really wasn't until I got the
Mhm.
right kind of test that it came back screaming positive, and we were like, oh my gosh, how did we miss it?
Yeah. Yeah. So what did the naturopathic doctor do differently? I mean, clearly he or she did different tests and everything, but what exactly did they do differently?
Yeah, my treatment was all an herbal protocol, which was
Okay.
amazing. It was just a lot of tinctures and then a lot of supporting my body by getting rid of things like environmental toxins, making sure I'm
Hmm.
resting, sleeping, but also moving my body, making sure I'm sweating to get it all out of my body, eating really well, just kind of supporting my body holistically.
Wow. Okay. And did for you, was it really just all of the natural things? Like, was there any other medication or anything else that you needed, or was it truly just like natural herbs and tinctures and exercise really that helped?
No, it genuinely was. When I first got
Wow.
diagnosed, I was graduating college and getting ready to move out to Arizona for naturopathic
Okay.
medical school. Because by that point,
Yeah.
I was like, I'm hooked. Like they found my diagnosis. Finally, like I'm
Yes.
gonna do this too. But at the time, there's not a whole lot of naturopathic doctors in North Carolina. So I was like, okay, I'll just go to like, a regular integrative MD. They're covered by my insurance. Maybe they'll have some good treatment options.
Yeah.
They started me on quite the cocktail of antibiotics. I was on 10 different
Okay.
antibiotics, and we would cycle them. So
Wow.
I would take like 4 on Tuesdays, Thursdays, and Saturdays, and the other 6 on Mondays, Wednesdays, Fridays, and Sundays. And we would cycle that. And he had me on a protocol to be on it for about 2 years. And I deteriorated.
On antibiotics for
Mhm. 2
2 years.
years. Yeah.
I
And
mean, I
my,
just know that a week of antibiotics can
yes.
really screw with your gut, but 2 years, holy cow. Sorry, I didn't mean to interrupt you.
Yes. Oh my gosh. No,
That
you're
blows my
okay.
mind.
It was crazy. But that is usually the standard protocol for chronic Lyme in the conventional medicine world. If they recognize it, that's still something I think they've come around to more, definitely since I was diagnosed, but still up and
Hmm.
coming. But no, so I only made it about 5 months. By that point, I was sick as a dog. I had lost so much weight. I like it's a miracle looking back on it that I graduated college because I was so sick at that time. And I just
Wow.
remember graduating and I told my mom, I was like, I need to find something else. Like I cannot do this. I can't go to medical school being this sick. Like I need to take a
Yeah.
break and figure something else out. So
Yeah.
I took a break that summer. When I moved out here, I started seeing a naturopathic physician at my school. And they were like, okay, no, 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 we're going to do something totally different. They got me on the
Yes.
herbs, and I really just started soaring. Like, there wasn't a whole lot of feeling bad before you feel good. Like, I just started feeling so much better pretty quickly.
Oh, that's amazing. And then I'm sure there was like diet changes and things like that as well.
Yes, oh my gosh. Lyme, I think just it can really hit anybody's system. For me, I always say I was fortunate because it really just hit my gut was the biggest thing that was impacted.
Okay.
I knew a lot of people that like they would get neurological symptoms like constant
Wow.
seizures. I was so fortunate to like escape all of that, but food allergies hit me really hard and I've recovered a lot since I've been in remission for so long. I've added a
Yeah.
lot of foods back, thankfully. Now it's usually just like wheat that it's the one lingering allergy. But
Yeah.
yeah, the
Yeah.
allergies were really the big thing. So I had to change my diet drastically to kind of accommodate all of those.
Yeah. And I would assume too that for be it Lyme's disease or whatever type of whatever ailment or disorder that it is, I when you do the when you go the more naturopathic direction, I would assume that when you're changing your diet and you're taking out the environmental toxins, that's not just like a temporary thing, right? I would assume it's like committing to a total lifestyle change. Is that right?
100%. But it was something honestly that it's like I'm so happy to do if it just gives me my health back and my life back.
Yeah.
Like, gosh, at that point you would just do anything, you know?
I'm sure. I'm sure. Yeah, yeah. Wow. Okay. Well, thank you for sharing that because that like I want to see you. Can
Oh,
you be my doctor?
sweet.
When we stop recording,
Absolutely.
actually, I'm going to be asking you a few questions if that's okay. Um,
Absolutely.
okay. Well, that just sounds wonderful. Okay, so I want to kind of take kind of tangent for a minute, and I want to talk to you about FEM because I know that you're also a FEM instructor. So can you tell me a little bit about what FEM is, and just like your intro to FEM and how well, and also to how that helps you in your practice.
Absolutely. So FEM stands for Fertility Education and Medical Management. I discovered FEM in college at our little Catholic campus ministry. We had a lady who was a FEM instructor, and every month she would come and preach about FEM. And when she heard I was going to medical school, she pulled me aside and was like, you have to be a part of FEM. And I was like, yeah, sounds good. And then med school starts, and that's four
Oh,
years of
sure.
craziness. So it just gets
Yeah.
pushed down the
Yeah.
line. But God bless her commitment because she would still reach out to me every year on Facebook and say, did you sign up for
Good
FEM
for
yet? Did you
her.
sign up for FEM? So my last year of school, I was like, okay, I will sign up for FEM because I knew I wanted to do fertility. I always kind of thought I would maybe like teach patients Creighton or something like that. And then I learned Creighton personally and loved it, but it was tough to learn. And in
Yeah.
the world of fertility, people aren't usually the most patient. They really want results pretty quickly. And
Preaching
learning,
to the choir right
yeah.
now.
So learning FEM, I was like, okay, this is like it's like a modified Creighton. Like I love that we're still using cervical
Okay.
mucus. I love that for my patients that come to me and say I don't get cervical mucus. I love that I can teach them LH strip testing. Like it's very
Yeah.
versatile,
Yeah.
but it's very easy to learn. I like that there's an app, so it's very attainable for my patients. So they're not
Yes.
necessarily just glued to paper charting. Just
Sure.
a lot of good pros about it. So once I actually learned about it, I was like, great, I'm going to commit to FEM because I needed a method to teach my patients, especially for the ones that just come and have no idea what charting is. So
Right.
learned FEM, absolutely loved it. Started teaching, absolutely loved it. My patients loved it. It's
Yeah.
so easy to pick up, but the way you watch people become so empowered from it is so awesome. It's so rewarding. So
Yeah.
after I decided to start learning and teaching, I decided to join their medical management program. And that was awesome. It's like a whole weekend incentive. Mine was in Ohio. I did it last summer and it was incredible. It's just a whole weekend with like the founder of FEM. And you're learning about all their research, the research they've done and are constantly completing. It's just an incredible organization, and the way that they are committed to constantly improving their protocols based off of new research was something that really kept me hooked with FEM too. I loved that it wasn't just like, here's this algorithm and now you're going to
Right.
use it forever. They're
Right.
constantly
Yeah.
evolving. So I thought that was a great sign, and it put a lot of my trust into FEM for sure. In my practice, I would say I use them a lot for charting for sure. I also love the FEM approach to labs. It's a lot more comprehensive than lab work you
Mm.
would get at like a MD's office. That being said, I add a lot of labs to it, so it's not quite as comprehensive, but it's like a good in between step. And
Okay.
it gives us still a good basis to go off of. I just will add my own to it as well to
Yeah.
be even more
Yeah.
thorough. I
Sure.
will say I actually rarely use traditional FEM protocols just because they all are pharmaceutical based and nobody comes to a
Okay.
naturopathic doctor for meds. So
Totally. Yeah.
but I love the FEM protocols. They're great for like an MD or a conventional model of medicine. I've just spent a significant amount of time converting the protocols to a way
Sure.
that's conducive for naturopathic medicine and herbs and things like that.
Okay. So you keep saying herbs. I want to go back to fem, but I need to pause here really quick because you keep saying herbs. Tell me, like, this is going to be such like a noob question, but like when you say herbs, what exactly does that mean? Like, is it in a supplement? Is it, how are you adding it? What herbs do you recommend for what? Like, just go there really quick because I'm so
Yeah.
curious about that.
Yeah, it's so different for every patient. Oftentimes,
Okay.
herbs I'll use as like supplements because I like a blend of herbs. They're a lot more gentle than things like meds. So
Sure.
usually it does take a nice combo of herbs to really push the needle. So
Hmm.
usually I leave it up to my patients. Oftentimes we can almost always get a nice blend with like capsules or tablets, or if they prefer a tincture, we can go that route. So
Okay.
one or the other. Usually my patients are like, nah, just give me the capsules. It's easy. I'll just down it.
Yeah.
So
Yeah.
usually we
Yeah.
go that route. But gosh, it's so different for every patient because everybody's gonna need something different. But like for
Mm.
example, like one really popular one that I think almost everybody has heard of is like Vitex or Chase Tree Berry. That's like a
Yes.
really common one people use for progesterone. It's a great one for progesterone. It doesn't always push the needle all the way, but it can be like in those blends, it can be a really nice
Yeah.
one to support.
Yeah.
So that's like that's one example, but there's gosh, thousands
Okay.
of them.
Okay. And so is it based on the blood work that you're seeing that you decide what kind of herbs that they need for their specific
For
problem? Okay.
sure. And there's different
Gotcha.
tiers too. Like we have some that are super gentle. We have some that are more nourishing, like providing nutrients if there's deficiencies. We have some that are
Hmm.
really strong and will drastically see the hormonal needle move with them.
Yeah.
So it just depends on how the labs are coming back, if they need something more gentle or if they're needing something that's going to give a little bit more of a kick right now.
Sure. Okay. Gotcha. Yeah. You just kept saying herbs. I'm like, I need to go here because I just need to picture it. So, okay. So you've gone through the medical management of FEM. So I know that with FEM is really just like, in layman's terms, it's really just another method of learning to chart your cycle, right? So you've learned not only to be an instructor in it, but you've learned also the medical management of it. So by learning the medical management, and you were saying that you kind of you change some of the protocol in order to be more naturopathic. But have you had like how much success have you had with that? Is it something that you use very commonly with your clients, or is it more of just kind of like an as needed basis? Like how often are you using FEM protocol?
FEM protocols, so the specific protocols, since they are pharmaceutical based, the only time I would say I really ever need to use them are one, I can only use them for patients that are in the state of Arizona because that's the only state I have
Oh,
prescribing rights.
sure. Okay.
So I most often don't have to use the exact protocols. I just use my little naturopathic swaps for them, but they are super successful even with the naturopathic swaps. So there's definitely something to that for sure.
Okay. Okay. Gotcha. Yeah, that is really amazing, especially too. I'm sure that you could even help so many more other naturopathic doctors like go into the world of fem or just go into the world of
Yeah.
learning to chart your cycle. Is that a pretty common thing with naturopathic doctors is to still like help the women learn to chart their cycles because just so much information can be learned from that, or is that not necessarily something that's used primarily?
Honestly, sadly, it is really not something that is used that often.
Okay.
We actually can prescribe birth control even as naturopathic doctors, which I think
You're
is
kidding.
horrible. I think it totally goes against the
That's
naturopathic
like,
modality for so
yeah.
many reasons, and it irks me so much. But honestly, you really do have to seek your own education, and I'm grateful for Catholicism and my understanding of NFP even being in existence
Yeah.
because we had a very quick lecture on, gosh, just any types of what they consider contraception when we were in school, and they were like, and there's NFP and it's not successful, moving on. And I was like, oh,
Yeah.
what?
Yeah.
That is not
What? What?
correct.
Yes. Oh my gosh. Yeah.
So, yeah, I
Yeah.
mean, we have a lot of people that like they are very passionate about it, especially if they're in the hormonal world and they will teach it and preach it. But it's not something we're really taught in school in depth, which is so
Wow.
sad to me.
That is so surprising. What that just completely blows my mind that that
No.
even in a naturopathic school they would still say, "Oh, okay, well here for pregnancy is still seen as an ailment or a sickness
Yeah.
that you need a medication for rather than
Yeah.
like let's at least go a natural way of trying to avoid pregnancy." That blows my mind. Wow, that is
It is
crazy.
insane. Could go on many
Wow.
tangents about it. I'm like, this is so far from root cause medicine. What are we doing here?
Yeah, yeah. Wow, that's crazy. And also too, I don't know too much about this, but I have heard as well that hormonal contraception can also affect your gut health. And I'm sure it just like completely redoes everything else that you're trying to do with herbs and diet changes and all of that. Like, wow.
So much that it undoes, so much that it allows to continue. Like all of our hormonal imbalances just continue getting worse under the surface because it's just slapping a band-aid on it. Like it's just, it wreaks so much havoc in every
Yeah.
way.
Yeah, yeah. So I'm assuming then, for on a moral standpoint, of course, but also just on a medical standpoint, you personally do not prescribe birth control of any means. Okay, that's
Yeah,
wonderful.
never,
Yeah,
never. And obviously, for moral reasons, it's a huge thing for me and always has been. But yes, even just coming from, if we totally took that piece out and we were just looking at science and medical based knowledge and what's healthy for the body, that is enough reason on its own, I think.
yeah, yeah. Oh, for sure. Now, I want to give you another kind of scenario because I want to get kind of deeper into, okay, I feel like some women diet change and environmental changes, like bam, it's good. They're good to go. But I'm thinking of a woman, like let's say she has, is it class 4, stage 4, like endometriosis? Like where do you go from there in a naturopathic sense? Because in my understanding of that is even to properly diagnose endometriosis, you really do need a diagnostic surgery, a diagnostic laparoscopy. So, kind of go into okay, if somebody is really having severe endometriosis or even a severe PCOS or something that they might need even a surgery to correct that, in what way do you go then as a naturopathic doctor versus a traditional doctor?
Yeah, I do try to avoid surgery whenever we
Hmm.
can, mostly because I just don't want extra scar tissue being
Yeah,
created in that area. Sometimes it's severe enough where, patients are just like, get me out of this pain, this is awful.
yeah,
But really, we look at one hormones, estrogen dominance has been largely linked. That being said, I have a lot of patients with endo and they still have low estrogen. So at that point, we start looking at, okay, are they getting that xenoestrogen exposure? Like,
Yeah.
what is the environmental toxin exposure like? We look at nutrition, we look at the liver a lot too. Oftentimes with endo, the liver is going to be super sluggish. It's not detoxing well. Supporting the liver is going to be huge. Even simple things like castor oil packs can take a lot of
Mm.
inflammation, and inflammation is a big thing with
Oh,
endo. So
yes,
taking
yes.
down the notch with inflammation is a big place to start. And looking at other hormone levels too. There's been a lot recently coming out, and Fem has kind of preached a lot about this of the link between like prolactin being high and endo.
Mm.
So a lot of times the
Okay.
Fem protocol is like just get them on like a prolactin lowering medication. That's not necessarily my approach, but I do think taking
Yeah.
approaches to decrease prolactin, that's huge for endo. Even if it's not crazy high, even if it's just a few points high, it's still significant enough
Hmm.
where it can perpetrate the endo. So treating that
Yeah.
and making sure everything else is in balance, that's usually a good starting spot. I do also start with a GI map. There's about 6 or 7 main bacteria that have been linked to endo pretty consistently. So I
Okay.
do usually see them being high or in some kind of imbalance on my patients' gut tests. So usually we
Hmm.
check the gut too.
Okay. And then do you see that if because you said you have multiple patients with endometriosis, do you see that those types of treatments actually like shrinking the endometriosis that they have? Like could it get to the point where it is actually gone, like they have no more sign of endometriosis? Like what kind of success have you seen from that?
100%. We've seen stage 4 endo go from no endo or to the point where at least
Wow.
like since my patients are trying to conceive, they get pregnant and then almost always symptoms get so much better in pregnancy. So
Wow.
usually they are able to get pregnant, they're feeling awesome. So that's
Yeah.
usually what else see happen. But absolutely, it's something that is so treatable for sure. And surgery has its time and place, but if we can start with the least invasive first and
Sure.
it be just as successful, why not?
Yes. Yeah,
Especially with how
absolutely.
fast it can regrow. We want to again come back to the root cause. If we're doing surgery, we still want to address why it was there in the first place so that you don't need constant surgery throughout your life.
Right, right. And I actually even have a few clients that have had endometriosis in the past. They've had it surgically removed, but it did come back. And so now I don't know what their lifestyle looks like. I don't know any like extenuating circumstances there, but knowing that, I mean, that's a disease that really can wreak a lot of havoc. And so it's really beautiful to hear too that even going the natural path can still take somebody from stage 4 endo to having none. I mean, that is truly amazing. So, wow. Okay, final, maybe not final question because knowing me, I'll probably have more but after this one, but one of the last questions I'm thinking of too is there ever a circumstance where you would say that there's a reason to go a more traditional route with medicine, whether it be taking medications or pharmaceuticals rather than going the naturopathic path? Or do you believe that every single, whatever it is, anything, any illness or could be also treated with naturopathic medicine?
I think both. I think
Okay.
everybody can benefit from naturopathic medicine. That being said, depending on what the root cause is, maybe it can't always move the needle 100%, but it can take you
Hmm.
50%. I
Okay.
think everybody can probably benefit from the
Sure.
lifestyle, nutrition, exercise
Totally.
changes,
Yeah.
the
Yeah.
environmental toxins. That does so much. The one exception that sometimes I've seen be a barrier is sometimes my patients will have, and hasn't happened too often where we haven't been able to control it with things like really, really strong herbs, but they'll have like a benign brain tumor called like a prolactinoma. So it's
Okay.
like this little tumor just hanging out, pumping out prolactin. So I see that usually when prolactin's coming back in like the hundreds or thousands.
Okay.
And there's a lot we can do with naturopathic medicine to get prolactin levels down. Some of my patients respond awesome, but some of them, the herbs and all the things that we're doing just aren't quite strong enough. But they don't necessarily want to have a surgery right now. So sometimes getting on a medication can be something that can significantly shrink the tumor. I just always stress that we want it to be as temporary as possible, which
Sure.
usually looks like, maybe every few, like 6 months or so, they're getting an MRI, seeing if it's, shrinking or not, if the medication's successful. So it's something that we kind of monitor, but really it's
Hmm.
just like in extreme circumstances like that, I would say that I would say we would go towards medication in conjunction with naturopathic medicine.
Okay, gotcha, gotcha. And I know that you mostly do telehealth. So is it the same? I guess like if you're doing telehealth with a traditional doctor and you're in Arizona, let's say, you can really only see a doctor who is licensed in Arizona. Is that the similar with you that you can really only see clients in Arizona, or is that different being in naturopathic?
No, thankfully, so I can actually see patients across the globe, even in other
Oh,
countries, which is
wow.
phenomenal. I just only have prescribing rights in the state of Arizona, but we can
Gotcha.
still order labs, we can get you supplements, we can do just about everything else, even if you're in another country, thankfully.
Okay. Oh, that is so amazing. That is, yeah, that is such a gift
Thanks.
too, because especially when you're looking for someone like you who it's sometimes hard to come by, right? Like it can be really helpful to even have somebody that's not in your area but still trusted and can still help you. So that's amazing. Well, Dr. B, we're nearing the end of our time, so I just want to thank you so much for all this information. I definitely want to have you back on one day because I would love to go in further with like inflammation and gut health and that's xenoestrogens. That stuff is just it's really interesting me right now, and I'm learning more about it. So I'd love to have you back on one day to really get more further into that. But before we end for today, can you tell our listeners if they are interested in working with you, where they can find you?
Absolutely. You can reach me through my website. It's just newevehealth.com. So we can get in contact there, or you can reach out directly. My email is drb.nmd@newevehealth. So feel free to reach out either way.
Okay, awesome. Well, thank you again so much for being on the podcast today, and I hope you have a great rest of your night.
Oh, thank you. It was a pleasure.
Thank you for listening to the Truth and Fertility podcast. If you are enjoying this content, it would be amazing if you could leave a 5-star review. That helps me tremendously to be able to continue to produce these episodes for you. Remember that these podcasts are available on Apple, Spotify, and Amazon, and YouTube. And you can always go to my website, truthandfertility.com, to learn more. Thanks again for listening, and I'll talk to you again next week.